At first glance, it is a striking image, a significant, sometimes massive swelling at the base of the neck. This is a goiter. But while the physical appearance is what gets noticed, a goiter is actually a silent messenger. It isn't a disease in itself. Rather, it is a red flag from your endocrine system. It is the thyroid gland's way of shouting that something is wrong. Today, we're going to look past the swelling to understand the how and the why of this condition.
To understand the goiter, we have to look at the engine, the thyroid gland. Shaped like a butterfly, this tiny organ controls your body's metabolism. But it doesn't work alone. It's part of a complex feedback loop called the HPT axis, the hypothalamus, pituitary, and thyroid. Think of the pituitary gland as a thermostat. It monitors the levels of thyroid hormones in your blood, which are thioiodothyronine and thyroxine, also known as T3 and T4 respectively. If levels are too low, the pituitary releases thyroid stimulating hormones, or the TSH. This signal tells the thyroid to work harder. In a goiter, this signal often gets stuck in the on position. The thyroid is overstimulated, causing its cells to multiply and the gland to enlarge in a desperate attempt to satisfy the body's demands for hormones.
So why does the system fail? Globally, the number of cause is nutritional. Iodine deficiency. Iodine is the essential fuel the thyroid needs to build hormones. Without it, the gland grows larger to increase its surface area, hoping to trap every stray molecule of iodine in your bloodstream. In developed nations, the cause is often autoimmune. In Graves' disease, for example, the immune system creates antibodies that mimic the thyroid-stimulating hormone, tricking the thyroid into growing and overproducing hormones. And conversely, in Hashimoto's thyroiditis, the immune system attacks the gland. As the thyroid is destroyed and hormone levels drop, the pituitary pumps out massive amounts of TSH to compensate, leading to the same result, a goiter. Whether the gland is overactive or underactive, the physical result of that struggle is the swelling we see.
Goiter isn't just about how you look. As the gland expands, it occupies space meant for other things. Patients often describe the tight feelings in the throat because the thyroid sits right in front of your windpipe and food pipe. A large goiter can cause a persistent cough, hoarseness in the voice, or even difficulty swallowing and breathing. Diagnosis usually begins with a physical exam followed by blood tests to check those thyroid-stimulating hormone and T4 levels that we discussed. Doctor may also use an ultrasound to see if a swelling is a single nodule or generally enlargement. In some cases, a tiny needle biopsy is used to ensure the growth is benign.
Now, the good news is, goiters are highly treatable. If the goiter is small and your hormone levels are normal, a doctor might simply monitor it, and this is called watchful waiting. If it's caused by an underactive thyroid, simple hormone replacement pills can often shrink the gland by signaling the pituitary to stop sending so much TSH or thyroid-stimulating hormone. And for overactive glands, radioactive iodine therapy can be used to shrink the tissue. If a goiter is large enough to make breathing difficult or is suspicious of cancer, surgeons may perform a thyroidectomy to remove parts or all of the gland. But perhaps the greatest success story is prevention. So the simple addition of iodine to table salts has made nutritional goiters a rarity in many parts of the world, and it's a powerful reminder that even the most complex endocrine systems rely on simple, fundamental building blocks to stay in balance.
Understanding the goiter means understanding the delicate dance of our hormones. Thanks for watching.